rest. Well, the AV node would kick in, and then something would go wrong, and you'd have to go get checked out and that sort of thing. That's kind of cool. But wait a minute. What does that tell me about sodium levels in my body?
So if they're low, you won't get as much fire.
It's actually reversed.
Okay.
Okay? Even in the case of like skeletal muscle and the nerve, all right? If sodium levels in the body are low, these systems get overactive. I know it's weird. If there's too much, they get sluggish. So now, what is important about lab reports that you may have to read about a patient's sodium levels?
You want ideally 0.9%, right?
Yes. You would want the way that lab reports are done now, they'll give you what the level is of the patient, then they have off to the side something that lets you know the norm. You're checking to make sure they fall within the norm.
Like at the hospital I work at, for them, like, our like charting system, when they get the results back, indicate, like, so they'll have like what the normal range is. And so they'll like, it'll go in different colors, whether it's too high, too low, or if it's like a vertical result.
They use color coding.
Would it also affect like how hydrated your body is?
Mhm.
If you're dehydrated, you're gonna have
Yes.
a higher salt content.
Because what you're learning the kidneys, when we start talking about the kidneys, sodium follows water. Okay, water follows sodium. So it will affect what's going to take place in the kidneys.
It can also affect like mental status. We have a patient who has pulmonary hypertension, and her sodium was like so low that she was like,
Disoriented, was she hallucinogenic?
yeah, she's still not like 100%, but she's definitely like when we first met her to like now, like she was like worried about sometimes like at home. She thought she was home, and she's like, no, I need to go like get the dog out. Like
See, this is what will happen, and I keep pointing out the elderly, mostly because it will be elderly that reflect this. But it can be in cases of, like we've said, congenital, genetic, other health issues that can be present, okay? And people can actually have situations where their sodium and potassium are affected. And that means until they actually diagnose that particular issue and begin to address it by like maybe giving the supplement or something to that effect, they will have lots of different physical traits that show up, like, for example, the the out of the head, like not being within the normal sense. And it's something, unfortunately, that for the elderly, as things begin to slow down in their bodies, like the function of their kidneys and so forth, it actually affects their blood levels and affects their heart and everything else, their skeletal muscle, nerves, everything else.
especially with like pulmonary hypertension, it's like where basically their lungs start to fill with fluid, and so they have to be on certain medications to keep that,
To keep
or
it
else they
down.
will literally like drown in their own
Like on the Lasix and stuff
yeah,
like that.
That particular patient, she had really she was getting she would have to get like multiple paracentesis because she was getting like a bunch of fluid in her abdomen.
Yes. And people who have stuff like COPD, cancers, and so forth can also develop those types of issues. So it is something that's it's one of the things that is very clinically significant, these ions. Okay, you guys take a break. Be back at 10:30 to start the test.